UW Health Chief Quality Officer Dr. Jeff Pothof is with us again today.
We're taking your calls at 608-270-9933. It's a great day to call in. The phones are wide open if you have a question for Dr. Pothof.
Doctor, good to see you.
Yeah, good to see you too.
Before we take your calls, if you're planning on a spring break trip, what kind of health precautions do you need to take?
Yeah, I mean, I think it's a lot easier this year than it was the last couple years. I think things that I encourage people to do, certainly keep up on those vaccines, just to make sure that you're not at risk for things. We talk about COVID, influenza, but also if you're traveling out of the country, there are diseases out there that we don't have a lot of experience with in the U.S. Yellow fever, typhoid, there's dengue out there. Some places have malaria. You need to prophylaxis for that. So if you are taking kind of one of those exotic trips, go ahead, look at the CDC travel site, see what they recommend, and then contact either a travel clinic or your primary care office to see if you need to get something. We
reported earlier this week that SSM Health is dropping its mandatory mask requirement at its hospitals and clinics. Tomorrow, yep. That's right. Is that something UW Health is looking into as well?
Yeah, we're certainly looking into it. I think one of the things that makes us a little different is we have a fairly large population of very at-risk patients, and the health system's been so busy, they're not just located on their units where we could say, hey, you just have to mask on this high-risk unit. So we're trying to figure out how to keep those patients safe, but also follow best available evidence on need to mask or not.
Okay, so the UW may be heading in that direction, but...
Yeah, I think our desire is not to be masked for forever, but not quite there yet.
All right, we have a caller. I'm not sure who it is, but you have a question about COVID and blood donations.
Sure.
Hi there, can you hear us?
Hi, Dr. Pothof. My name's Lonnie, and I'm calling you from Milton. And I have a question. Can people who have had COVID be blood donors and or organ donors?
Yeah, no, I think that's a great question. So really, there isn't any prohibition against folks who've had COVID in donating blood. Obviously, they don't want you to come in and donate blood when you're having symptoms and actively have that infection. But once you've recovered, really no prohibition on giving blood. In fact, earlier in the pandemic, we were looking for folks who had COVID to donate blood so we could harvest those antibodies and use it as a treatment for folks who came down with COVID.
So no time limit?
No, not necessarily, and same for organ donation. If you're a candidate, the transplant center would work with you so that you could be a donor.
All right, very interesting.
All
okay,
right.
Let's go to, I'm sorry, I'm not sure what your name is in Sun Prairie.
Layman?
Lamin.
Lamin. Okay, nice to meet you. Go ahead with your question.
Mark and Susan, I'm a big fan of you guys.
Well, thanks for calling in. What's your question?
The question is about, I'm heading to Florida here in a week, so wondering what the precaution is.
What was the question?
He's heading to Florida in a week. Any precautions you should take?
Oh, any precautions? I would say normal precautions. So you're going to want to make sure that your vaccines are up to date, especially if you haven't had COVID recently. Kind of cross off the chance of getting severe COVID while you're down in Florida. Maybe check off flu. There's still a little bit of that going around, so if you're not vaccinated from that, get that. And then ideally, just make sure you know where you would go if you were to have a medical emergency, where's the nearest emergency department. But for the most part, traveling to a place like Florida, precautions fairly minimal, relatively safe travel to Florida this year.
And if you've had 4 vaccines and the booster, are we good for now, or should you get something else if you're traveling?
Yeah, easy answer. So if you've had that bivalent booster, you're good to go. You don't need anything in additional to that as it pertains to COVID.
Okay. Let's go to Cheryl now from McFarland. Hi, Cheryl. What's your question?
I have a question in regards to the shingles vaccine. I have heard that a possible side effect with that, and I'm not sure I'm pronouncing it right, is Guillain-Barré syndrome. And I had inclusion body myositis, and I'm wondering if that would be something, that I shouldn't take because there's a possibility of that side effect.
Yeah, no, I think that's a great question. So there actually are a fair number of vaccines that come with a very small risk of something called Guillain-Barré syndrome, which is a process where our nerves lose their insulation, typically starting in their feet. It's self-limited, doesn't last forever, but you can get weak. Usually starts in the feet, kind of works its way up. It's exceedingly rare. So when we look at a decision to get a shingles vaccine or any other vaccine versus the risk of the side effects, the likelihood of you having something bad happen with shingles is actually a fair bit higher than the risk of you getting Guillain-Barré. And even with the inclusion body myositis, likely not a contraindication to getting that vaccine. Certainly talk with your provider and say, hey, just want to double check on this. But for the most part, getting those vaccines is much more beneficial than the odd chance you develop a complication like Guillain-Barré.
All right.
Let's go to Terry in Watertown. Hi, Terry. What's your question?
My question is on enzymes of the liver. What is the level that you're supposed to be at?
Sure. So I think what you're probably referring to is we have a bunch of different liver enzymes. The ones that folks are most familiar with are usually AST, ALT, there can be bilirubin, and essentially liver enzymes with mild elevation, say something over, and depending on the test you're using, these numbers could change. Anything over 100, 130 can indicate mild inflammation of the liver. There's so many reasons that could happen. Viruses can do that. As you start getting higher levels of inflammation, that can suggest something else going on with the liver, sometimes cirrhosis and things like that. Elevated bilirubin can sometimes suggest obstruction of bile getting out of the liver into the intestinal tract. But really, if you have questions about your liver enzymes, best to talk with your provider, because based on your specific situation, that number may be important or it may be okay. So I would talk with your primary care doc and say, hey, help me understand my liver function tests.
Normal can be different for other people.
It's true.
All right. Doctor, thank you. We'll see you soon.
Yeah.
We're done.
You bet.
Time goes by fast.
Thank you all for the next one.
Thank you all for calling in.